And let's bring in Chief Innovation Officer at Boston Children's Hospital and ABC News medical contributor, Dr. John Brownstein, for more on this. Dr. Brownstein, thanks for being here. What are the different things to consider when deciding whether to get this fourth booster or not?
Yeah, thanks, Diane. Good morning. It is very confusing. We're adding another shot into the mix. And so there's a lot of questions about whether you should go out and get that second booster. What we have found is that that booster is helpful to those who are older and have underlying conditions. And as you heard in the previous piece, anybody over 65 should probably get one. And if you're over 50 and have underlying conditions, probably a good idea too. And this has to be done 4 months after your prior dose. Now, of course, it gets a little bit more complicated if you had prior Omicron infection. You want to talk to your provider. You may want to wait a little bit longer because that additional infection acted as a boost to your immunity. But what we have seen from data from Israel is that, that second booster can protect your risk against hospitalization and death. So it does make sense. But I do want to highlight that this recommendation shouldn't take away from the many millions of people that have yet to be fully vaccinated, yet to be boosted for their first dose. That still remains the most important thing we can do right now to get the population fully up to date with their vaccines, ultimately protect them against the serious consequences. I think that is still the most important message, even bigger than this second booster recommendation.
Now, the BA.2 subvariant is starting to create a surge in cases in many parts of the U.S. What are we seeing for hospitalizations and deaths, and how important is it to distinguish between those numbers?
It's a really good point. BA.2 is now the dominant variant across the country. Many parts of this country are dealing with surges as a result of BA.2. What's really good is actually right now we're dealing with the lowest levels of hospitalizations that we've seen throughout the pandemic. So there's sort of a difference between what we're seeing in cases and hospitalizations. As you know, a surge in cases ultimately can cause an increase in hospitalizations and deaths. We're not there yet. And this is the challenge now. We're trying to vaccinate and give second boosters to people ahead of what may be a surge. We just don't know. So there's a bit of a hedge here that we want to protect people, but we ultimately don't know what's going to happen in the next few weeks. And so this is why it's better to be protected. The downside of that second shot isn't significant. The benefits are much more, way much more against any potential downside of getting that second shot.
Now, during the last surge, at-home tests became very popular. The government even mailed some out to people. So there are a lot of people now testing at home instead of going to testing sites. Does that impact the numbers when you try to look at case counts?
Yeah, this is, of course, for me and my family, we use those home tests. They tripled in Omicron and there was huge demand. And that's great. Consumer preference, people are getting to test at home. It's so much more convenient. People can make decisions about whether to travel or to gather. At the same time, that data isn't ending up in public health databases. So we're sort of flying blind a little bit. We don't fully know the full extent of the impact of Omicron, this current surge. And then also when you're not collecting that data, it's not being sequenced. And so we don't fully know if there are new variants that are emerging. So there's some really real challenges here. This is why it's so important for government funding to put into surveillance, to figure out a way to collect all this data and make sure that we fully recognize the impact of COVID right now.
Now, today, President Biden is delivering remarks, and he's supposed to highlight the launch of covid.gov, a new website that the White House is billing as a one-stop shop to help people get access to vaccines, tests, treatments, masks. I know you were involved in the creation of this website. So can you walk us through what kind of an impact you think it could have 2 years into this pandemic?
I think this website is really just an aggregation of all the incredible work that's been done to respond to this pandemic, whether it's vaccines, tests, masking, treatments. There are different sites that people can go to figure out where to get, a mask for free, where they can get a vaccine, where they can do test to treat, which means a test plus a treatment on the spot at, say, a pharmacy. So this is trying to aggregate all that information, make it much easier for Americans to figure out what they can do to protect themselves and also get treatment if they do happen to get COVID. And so, I think hopefully this will sort of cut down the noise and really help, people figure out where to go to get what they need to protect themselves and their family.
All right, Dr. Brownstein, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.